Hello, I'm Shelby Thompson, and I'm a Master's of Science in Nursing student at Eastern Kentucky University. Today, I'm here to present a project proposal as a part of NSC 892 to determine family motivation in pediatric patients diagnosed with obesity. This project explores 4 randomized controlled trials that report results on effects of family motivation in childhood obesity prevention. The first study uses self-body image and eating patterns influenced by family environment. The second study uses family frequency of meals and how it can be associated with dietary intake by the child. The third research article found to support the data discussed used motivational interviewing in a randomized controlled trial to examine the efficiency of an adjunct motivational and autonomy enhancing intervention for behavioral family-based pediatric obesity relative to standard prescription behavioral skills. The fourth study offered evaluation of the effects of 2 intervention modalities concerning obesity among children. All of these studies offer different results in how they can be used for future practice for the advanced nurse practitioner. The purpose of this project is to determine whether family motivation can be used as a better intervention as opposed to usual care prescribed by the provider. Relevant research in this topic was used by databases provided by the Eastern Kentucky University. These research sites included CINAHL Complete, Medline, EBSCOhost Web, and PubMed. Keywords were used in the process of obtaining related data to the topic. These keywords included childhood obesity, family motivation, randomized controlled trials, and promoting family healthy lifestyle. Proposed methods for this study, and prior to beginning the study, we will need to use flyers and advertisements to be made aware to parents who are looking to implement better motivation for their child who has been diagnosed with obesity by the qualified medical provider. On the first day, all participants will be given preliminary documents that explain risk and benefits of the research. The documents include consent, questionnaires, information regarding participants, inclusion criteria, and the body mass index scale. Children participants will privately be taken height and weight checks to confirm body mass index. Once all forms have been filled out and necessary questions have been answered, participants will be placed in either a control or experimental group in randomized nature. A baseline questionnaire will be given to all participants. If the child is chosen for the experimental group, they will be given a baseline survey and Home Plus survey document as used in the relevant research. This document that provides intervention for families such as set meal times. The control group will be given a questionnaire and will be offered no intervention until the end of the questionnaire. At the end of the 1-year period, it will be evaluated to seek if positive impact variables were made in parenting and if the research showed significant changes in excess weight gain. After all of this data is collected, evaluation will need to take place. Evaluation will be made after all data is collected for this research. Z-scoring will be used to determine if any changes have been made in child weight gain, whether that being a constant among weight or weight loss throughout the research. This will help determine whether this research has been beneficial to the population used. This study may also help guide further research if significant results are found. This population being affected in rural communities is at an increased need for intervention in the United States. The CDC states that obesity prevalence is 13.9% among 2 to 5-year-olds, and among 6 to 11-year-olds is 18.4%. This data prompts a readiness for change among the pediatric population in the United States. In a rural setting, a small family health care clinic can be used as access for change to implementing the proposed methods of research that are included in this proposal. Thank you for listening, and I hope you take into consideration this proposal project for pediatric patients diagnosed with obesity.